My name is Gregory Andreassian. I'm a general surgeon. I was born in Dallas, Texas. Went to college at Texas A&M University, where I graduated in 1981. From there, I went to the University of Texas Health Science Center in San Antonio for medical school training. I graduated there in 1985 and stayed there for another 5 years to go through my general surgery training. I finished my surgical training in 1990. From there, I moved to Fredericksburg, where I've been since that time. My wife and I have raised 2 daughters here and have lived here throughout my career. General surgery is a specialty. My training is in surgery and treatment of diseases with surgery. I also do endoscopy, which is examination of the intestinal tract using fiber optic instrumentation. But most of what I do is surgical. The areas that I tend to focus on are surgical procedures involving the abdominal cavity, like the small intestine, the large intestine, the colon, the pancreas, the liver. Abdominal procedures include things like appendectomies for acute appendicitis, things that are emergency, but also elective surgeries. For instance, cancer of the colon has to be treated surgically. In this day and age, most of our surgeries in the abdomen are done using minimally invasive techniques like laparoscopy. It shortens the patient's recovery time and has a lot less pain associated with it. We have a program for our colon surgery patients where we have what's called enhanced recovery pathway, so that we have a standardized approach to colon surgery that gets our patients through the procedure with a lot of education before surgery. The surgical procedure itself is done laparoscopically, so it's minimally invasive. The recovery is quick, and the patients are back to work in short order. And with regard to breast disease and consultation, usually this begins from a referral from the primary care physician's office that in most cases starts when there's an abnormality identified either by physical exam or by breast imaging studies such as mammography. Well, it's very gratifying to know that you have had a positive impact on so many lives. And you know, everywhere I go, I run into people that I've taken care of in one capacity or another over the years, and by and large, it's been a good experience for them, and I mean, it's very gratifying for me.